take care of yourself. You are not alone. With all the resources available, I know our communities can put their mental health first and navigate this together. Please take advantage of the tools the Department of Mental Health has to offer mental health care. It's okay to say that you need help. Now I would like to invite Dr. Sharon up to say a few words, and I would like to thank you all for everything you're doing to help us flatten this curve. Dr. Sharon?
Thank you very much, Supervisor Barger. As we begin living through and adjusting rapidly to a new order, there is increased stress on us all. Whether or not we have suffered with mental health challenges before, as individuals or families, or even organizations, managing such radical change over a short period of time can be very difficult. In particular, with change comes the unknown, a perceived loss of control, fear for our safety, and heightened anxiety that can be especially tough on kids and disabled who, like everyone, require routines. This sequence is a normal reaction at all levels, and as such requires that we step up our county efforts with resources to be responsive in particular ways now and over the coming months. For those in need of immediate help, it is very, very important that you reach out and express your feelings with someone you trust, whether it's a family member, a friend, or a mental health professional. With respect to professional help, the Department of Mental Health can and should be contacted 24/7 at 800-854-7771. And I want to repeat that number, 800-854-7771. We are here to accept your calls, provide information, talk through issues, assist you with linkage to our system and/or other resources as indicated. In terms of things that we can do as individuals to ease our anxiety now, keep your healthy routines as possible, including proper sleep, eating well, and exercising to maintain and grow your resilience and well-being. Establish new routines and try to adopt an approach whereby new routines are not necessarily a bad thing. Staying at home and slowing down your pace can be a way to relax. Pick up old hobbies or take care of things that you have been putting off. And please avoid dangerous routines, including reliance on alcohol or drugs to numb your anxiety, or trolling for information that is likely rumor, as those things can only make anxiety worse over time. As we face challenges not only as individuals, but across the county, it is important to think also about our larger response, because the mental health ramifications are significant. In Los Angeles County, we are seeing unprecedented leadership from our board and administration who are fighting for our communities all day long, cutting red tape like never before, and pushing the state as well as the federal government to assist us now. This level of cooperation and coordination between the county departments is likewise totally unprecedented, and I salute all of my colleagues for their leadership, from the front lines to the back office. Within my own department, the tireless commitment to mission has been blowing my mind each day as we pivot towards new ways of doing business, double down on the most critical services to the most vulnerable populations, figure out ways to serve the general public at a time of collective anxiety, and remain flexible as these scenarios evolve on a daily and at sometimes hourly basis. And I can say the same about our network of community-based providers who are standing strong with us as partners through entirely uncharted territory. As I reflect upon the last couple of weeks and the entire range of people and groups and organizations working as a larger team in the face of adversity, I am perhaps most struck by the amount of collaboration we see across communities at every level. And that from a mental health perspective is our most vital indicator of collective well-being and our most effective weapon against COVID. Rather than panic, we are being calm in the face of adversity. Acts of kindness, interdependence, and unity have new meaning and are marking our collective response every hour of every day as we do simple things, like delivering food safely to the elderly, staying home, and managing our personal space. And with respect to personal space, and to reinforce the supervisor's comments, we must all understand and embrace the notion that social distancing guidelines are only about physical distance, but that connecting with ourselves, each other, and functioning as a close-knit society is more important than ever. Please reach out, take care of one another, and stay united for our individual and collective mental health and well-being. I'd like to now introduce or bring back Barbara Ferrer, our Director of Public Health. Thank you.
Thank you, Dr. Sharon, and good afternoon, everyone. Every day I feel blessed that I stand here with the leadership of our county, and I want to thank all of you who are here with us today and those who are elsewhere for your tireless work and commitment to this effort. And I especially want to thank Supervisor Barger. It's an enormous task that's before us as a county. This is the largest jurisdiction in the country. It's over 10 million people that we have to continue to be of service to, and we can't really thank Supervisor Barger and the Board of Supervisors enough for stepping up and providing a path forward for all of us to come together, work hard together, and really make a significant effort here to slow the spread of COVID-19. I want to update you on our current status. I'm really sad to report 4 additional deaths today, including 1 death that was reported by the Long Beach Health Department yesterday. This brings the total number of deaths to 11 in LA County. Tragically, one of the people who died was a person under the age of 18, a devastating reminder that COVID-19 infects people of all ages. These are difficult numbers to report because behind these numbers are families and friends who are experiencing terrible loss. We, the entire LA County community, keep you in our thoughts and our prayers. Today we're also reporting 128 new cases, and the total number of cases in LA County now stands at 662. Over the last 48 hours, there have been 256 new cases. 256, sorry. These cases include 21 cases reported by our partners in the city of Long Beach and 6 cases reported by the city of Pasadena. 42% of our positive cases occur in people between the ages of 18 and 40, and 39% occur in people between the ages of 41 and 65. 119 people have at some point been hospitalized who have been positive with COVID-19. That's about 18% of all positive cases. You can see our updated report every afternoon of LA County cases on our website. That's www.publichealth.lacounty.gov. As of March 23rd, over 5,700 people have been tested in LA County for COVID-19, and 10% were positive. We've been at about 10% since the beginning of us being able to do testing here locally. I'm extraordinarily grateful to Dr. Kazan for his leadership and his diligence in expanding capacity for testing in LA County. And as he reported yesterday, by the end of the week, we will have the capacity to add thousands and thousands of more test kits so that many, many more people, under the orders from their physicians and clinicians, would be able to get tested. And although things are improving, and we're grateful for everyone's patience as they improve, there's still limited capacity and sometimes long waiting times for results. And this means that we must, unfortunately, continue to prioritize who is getting tested. Testing is available primarily for people who are symptomatic and for whom a clinical provider has determined that testing is appropriate. We ask that you help us adhere to this guidance from both the federal and state government, as well as our guidance here in LA County. For those of you who are symptomatic, however, and you're waiting for your test results, please act as if you were positive. This means following all of our isolation directives. And for those of you who are symptomatic but you didn't yet get a chance to be tested, please act as if you too could be positive and isolate yourselves from others. Starting tomorrow, I also hope I'll be able to share with you information about outbreaks in institutional settings. There's a little bit of a lag time in these reports as we need to make sure that residents, family members, and staff in the facilities have been notified before this information is released to the public. As I mentioned yesterday, and I just want to remind folks today, social distancing is one very important tool that we use, but the second tool that we need to continue to ask for your cooperation on is adhering to isolation and quarantine orders. Isolation, just as a reminder, is required. It's required by law for anyone who's positive for COVID-19 or whose clinician has told them that they're likely to be positive for COVID-19. It's really important that folks do not wait to be notified by someone from the public health department if you've already been told by a provider that you're either positive, your test results were positive, or that you are to presume that you're positive before you begin to isolate yourself. We will be instituting some blanket orders that legally will cover all of us should we get that diagnosis. But as of now, we know that there are some long wait times from some of the commercial labs, and I don't want people to be sort of out and about while you're waiting for your test results. If you needed to be tested, it's because there was a good chance you could be positive. And if there's a good chance you could be positive, you need to be isolating yourself at home and really keeping away from all other people. And one of your tasks, if you are positive or you presume to be positive, is for you to notify your close contacts. Again, please don't wait for there to be an official notification any longer because of the long lag times in getting test results. If you are presumed to be positive or you're waiting for a test result, you need to immediately notify your close contacts so that they can begin to quarantine themselves. This is really important for family members, caregivers, close contacts, people who you work with in very close quarters at work, and intimate partners. All of these people also need to immediately quarantine themselves. They need to stay away from others. They need to not go out, and they need to do that for 14 days because the incubation period is 14 days. If you're sick with mild illness, it may not be COVID-19, but you're not even needing to go to see your doctor and you're not getting tested, you too need to stay home, isolated from others for at least 7 days and till you're fever-free for 3 days before you go back out. By doing both all of the social distancing that we've asked you to do and making sure if you are ill, you are staying away from all other people, and if you need to be isolated and quarantined, you're following those orders, we will slow down the spread of COVID-19. But it is going to take all of us, and all of us being diligent. A couple of other reminders. Domestic violence services are open. If you're experiencing domestic violence or you know someone else who may be, please know that help is available. The LA County Domestic Violence Services are open, the shelters are open and accepting intakes. Law enforcement will respond to any calls for domestic violence that come through 911. And emergency protective orders are still being issued. Nonprofit legal services are still available. So please, if you are worried about somebody else or you yourself are experiencing violence in your home, please call the domestic violence hotline, 1-800-978-3000. That's 1-800-978-3600. There are resources on the Domestic Violence Council's website, publichealth.lacounty.gov/dvcouncil. You're not alone, and we have lots of resources that are available for you for all kinds of issues that you may be facing during these very uncertain times. And now I'd like to open for questions.
Ladies and gentlemen on the phone lines, if you wish to ask a question, please press 1 followed by the 0. You'll hear an acknowledgement you've been placed in queue. You may remove yourself from queue at any time by repeating the 1-0 command. Again, for questions, please press 1-0. And one moment as participants queue up. Our first question comes from the line of Claudia Pistuda, representing PayNX. Please go ahead.
Hi, Barbara. This question is for you. Can you let us know if there have been any positive tests among inmates or the homeless population? And also, I know Dr. Galley isn't there, but perhaps you could give us an update on open ICU beds and the number of ventilators in the county.
So I cannot give you the information on exactly how many ICU beds are open today, but we could get that to you. And we can also get you the information on ventilators. I don't have that with me, but I know we can get that to you this afternoon. And the first question, could you remind me again the first question?
Any positive cases among the inmate or the homeless population?
Yeah. So although we continue to be testing people, both people who are in jails and people who are experiencing homelessness, to date we have no known positive cases. But I just want to remind all of us that could change at any minute, and we would expect in both situations that we would start seeing people who are positive, just like we're seeing lots more positive people in our communities. Thank you.
Okay, and one more quick question, if I may.
Sure.
We did see reports about traces of COVID-19 on one of these cruise ships 17 days later, which I think, was alarming to some people. Could you speak to that about how long this might last on surfaces? And I know some people are taking pretty drastic steps in terms of dealing with mail and deliveries and groceries and all this thing and, wiping things down and all that. Can you speak to that?
Sure. I mean, it's always a good idea for any virus to do a pretty decent job cleaning. And we've asked everyone to actually do more frequent cleaning on places that are touched often, both in your house and if you're out and about. I know Metro is doing extra cleanings, for example. We've also been very clear always about making sure that you're really careful about food and particularly about produce. This isn't just around COVID-19. This is in all kinds of situations. There's lots of other germs, and you need to be taking every precaution in your kitchen to make sure that you're washing all produce, fresh foods, that you're keeping your cutting boards separate, that you're using hot water and detergent when you're cleaning utensils. So we would ask people to really continue to follow the good public health guidance and be extra certain that you, in fact, are cooking foods appropriately, that you're not leaving foods hanging around outside. Cold foods need to stay cold. Hot foods need to stay hot. Common sense public health precautions will go a long way towards helping in terms of just protecting you and your family from all kinds of germs. I think there are a lot of questions appropriately being asked about how long this virus lives on the surface. And part of the answer might be it could live for a while. The question is how easily then does it get transmitted to a person? And I think there are lots of new studies that are coming out. On average in the past, we've thought that it's a fairly fragile virus. By that, I mean that it doesn't really live that long on surfaces and that it's not easily transmitted from surfaces. But like everything else about this virus, because it's new, we learn a little bit more each day. I'm grateful for all the researchers and scientists that are out there, helping us really better understand this virus. And we, like you, continue to just urge everyone to take all the precautions you can about washing your hands whenever you're going out, coming back in, before you eat, after you use the bathroom, after you're around other people. And certainly keep your hands away from your mouth, your nose, and your eyes as much as possible to avoid, just like you noted, Claudia, the possibility that you've touched something and now you're touching your mouth or your nose or your eyes, and you're in fact introducing this virus. So I don't think it's the main route of transmission. There's no evidence to suggest that it is. A lot of evidence to suggest that close contact remains the way most people are getting it from other people. But at this point in time, I would ask everyone to take every precaution that you possibly can. So thank you.
Thank you.
Our next question today comes from the line of Chris Weber, representing the Associated Press. Please go ahead.
Hi, thanks. For Supervisor Barger, in a TV interview, the sheriff said the public might be becoming numb to warnings to stay at home because the warnings aren't coming from law enforcement. Should these directives be coming from law enforcement to hammer that message home? And also, the sheriff says he wants to shut down gun shops. Do you know, is that happening currently?
So regarding the first, it's not about the sheriff or public health. It's about all of us working together. And so I think that together it's important for us to look at enforcement, but try to encourage people and remind them that, and it's important to know this, as Dr. Ferrer said, it takes 14 days in some cases. So some people assume if they're not showing symptoms this week, it doesn't mean it couldn't happen next week. We can't let our guard down. And that's why we talk about flattening the curve. So I don't think it's about just law enforcement. We have to work together, obviously, to make sure that people are complying. And that's what we are doing. As it relates to the gun stores, I would have to defer that to the sheriff because the sheriff gave that order. And so in terms of enforcement and all, I'm sure that someone within his information bureau would be able to answer that question regarding the thought behind it and how they're going to do enforcement.
Thank you.
Thank you.
And next we'll go to the line of Jim Rope, representing Westwood One News. Your line is open, sir.
Thank you very much. Yes, Jim Roop with Westwood One News. Dr. Ferrer, this is for you. The World Health Organization yesterday in its briefing said that from the first reported case to the first 100,000 cases, it took 67 days. From 100,000 to 200,000, it took 11 days. And then from 200,000 to 300,000, just 4 days. So Dr. Tedros says this thing's picking up speed. So with all of that, and testing, we hear a lot about testing, but the WHO also says that contact tracing is very, very important. Now, I know you're asking people to self-quarantine. If someone is tested positive, they're supposed to talk to their contacts. But a lot of people don't know they're exposed to a positive case unless they know where that positive case has been. That's number one. And then with all due respect, we saw what happened over the weekend with people asked to voluntarily comply with the social distancing mandates. So what can be done on the contact tracing, as the WHO says, that is an integral part that goes along with the testing. And then with restaurants that are still preparing food, what oversight is involved with that so that we know that the workers who are preparing those foods are doing it in a safe environment? That seems like a big old hole where infections could escape, if you will.
Sure. Those are all good questions. Let me start with the first question about contact tracing. We are 100% in agreement with you that as public health strategies, identifying cases that are positive and identifying their close contacts is the most important strategy that we need to continue. We need to do a lot more social distancing, as you noted, but the heart and soul of us being able to understand what this virus is doing and who it's infecting is that we retain some ability to continue to do that case finding and that contact tracing investigation. The issue that we're having is that there's a lag time now because of the testing issue. So rather than wait until there's a positive test, we have to ask people, if you in fact have been tested, you have to assume you're positive now and immediately isolate. Our orders that we reissue a blanket order later this week will in fact make that the law, that people are going to need to, if they're presumed to be positive or if they are tested positive, they need to isolate and they need to notify their contacts. That's not because we're not going to be behind them trying to help them do a good job, but it's because there's now a lag that could be as many as 4 days before people are notified about their test results. I'm training an additional 150 people at the Public Health Department to help with the investigations so that even when we have hundreds and hundreds of cases every day, we're still going to make our very best effort to get to people, give them really good information, and just like you said, make sure that people understand what the rules are. I often think that for some people, they're not necessarily doing what we're asking, but it's because they're not really clear about what we're asking. And so we have an obligation to make sure people understand and understand well what these isolation and quarantine orders really mean. But we're going to continue to do that, and we're going to continue to ask that people comply. I do want to note that these are legally enforceable, so people who are violating isolation and quarantine orders, there can be a legal remedy. We've had almost no cases where we've had to use that. Most people understand the seriousness of this disease and the implications for spreading it, as with other infectious diseases, and they comply with these orders. Your second question was about, people just not taking seriously the social distancing measures, and you've heard.
My second question was about restaurants that are still open for takeout and delivery. What oversight is there so we know that that's being done safely? Because, again, that seems like a big hole through which infections can get out into the society.
Well, you know that all restaurants here in the county are inspected by our health inspectors, and that's whether you're doing takeout or in dining. Our health inspectors are out and about. They're doing their routine inspections. They're also responding to complaints, as they always do. Those routine inspections are, those are not previously scheduled inspections, so we show up whenever we show up. There's everybody who's licensed, and again, you're shut down if you're not, but all licensed restaurants know that they get inspected, and they know what the rules are. Our inspectors are still out and about, and that's our job. Whether it's now takeout or it's in dining services, all restaurants are subject to comply with the health regulations around how they organize the preparing of food and how they go about serving food. So there are very strict regulations in place, and my sense is that we'll be enforcing that. So, next question.
Thank you.
Okay, next question.
Thank you. Next, we will go to the line of Mike Kessler, representing KPCC LA. Your line is open.
Hello. Hi. Can you guys hear me?
Yeah, go ahead.
Hi, Mike Kessler with KPCC here. I'm trying to get a better understanding of the stockpile, which you mentioned yesterday. I'm trying to get a sense of what exactly is this stockpile, what's in it, how is it getting distributed, how is it getting prioritized? Is there somebody at the health department representing the county who's a point person who is assessing the needs of various hospitals and determining which hospitals get this various PPEs? The reason I'm asking is because a number of doctors I'm talking to at hospitals around the region have been expressing concern that they don't know really what's going on with the stockpiles, and they're watching their PPEs start to dwindle, and they're keeping everything under lock and key and being very diligent about who they will and will not give those PPEs to. So I'm hoping that you can clarify for me and for other people in the community what this stockpile is, how it's being distributed, how it's getting prioritized, and how we can learn more about it. Secondly, on a similar note, you mentioned earlier that the number for ICU beds and ventilators weren't available, and I'm wondering if those will be made available on a regular basis later.
So on the second part regarding the ICU beds and the ventilators, Dr. Galley on a day-to-day basis is updating and tracking throughout the entire county. So the short answer to that is yes, we'll be able to get that answer to you as it relates to the ICU beds. And on the ventilator side, I'm sure that she has an idea in terms of the numbers, but we'll confirm that as well. On the first part, I'm going to let Dr. Ferrer answer that.
I mean, Dr. Galley and EMS for the county are, in fact, and have been for a very long time, sort of the regional coordinators of all requests for PPE and other, necessities that hospitals and healthcare providers need to make sure that they can operate, particularly during times of emergencies. They're also the ones that put in county order for PPE to the stockpile, and I know that they've asked for millions of face masks that and for N95s, and that those orders are being processed. But again, the best people to talk to about that are Dr. Galley and her team, and they can give you all the details, and we can make sure you connect with them if you're looking for the details of what orders have gone in. I don't have that information about exactly what's been ordered. I just know that we're very blessed in this region to have this regional approach and this sort of massive effort of coordination that goes across all of the hospitals. Thank you. Well, next question.
Next, we're going to go to the line of Steve Gregory with KFI Radio. Please go ahead.
Thank you. Hi, Barbara. Good afternoon. In kind of this mission of mine to clear up some misunderstandings and misinformation, a lot of people are making a big thing about symptoms. And I know you've talked about symptoms before, but can you please clarify the difference between mild symptoms and more severe symptoms, and clear up this thing about, when people have a loss of smell and taste, that means they have COVID-19. Also, with respect to ventilators, I suspect that that's only when a patient gets in the most severe state of the illness. What on average is the length that after someone goes on a ventilator or someone is diagnosed in severe cases that person passes away? Do you have sort of a timeline there? And also, with respect to inmates, have you inspected the jails of LA County, and how many inmates do you suspect will be released? Thank you.
So maybe I'll do the last one because I can't answer it. The jails are inspected, and in fact, the sheriff also has a plan around releasing inmates, and I think he'd be the best person to speak of that. I do know that correctional health, again under the auspices of the Department of Health Services, provides services for people who are in our jails, medical services for people who are in our jails, and I know they could, sort of give you all of the information around their planning for perhaps having an outbreak in the jails. I mean, we have had other outbreaks in the jails, and I want to say it's an excellent team. It takes a lot of cooperation between the sheriff deputies and correctional health to manage an outbreak, but all those systems are in place. But I think those questions are best answered by the sheriff. The question again on, sort of ventilators and, how serious is it once somebody is on a ventilator, and what's the recovery look like? That data varies. And again, we're just starting to look at data here in LA County. We've had only a small number of people on ventilators. You're right that it's very serious. You're absolutely having a lot of problems breathing when you're using a ventilator, when you have to use a ventilator in the hospital. But it varies on sort of how long people take to recover. I do want to remind people that one unfortunate fact about this virus is there's a lot of variability in sort of how the illness presents itself. Some people are getting very sick very quickly, and they're being hospitalized immediately and being diagnosed because they're entering the hospital fairly sick, and they've gone from feeling pretty fine to feeling very sick very quickly. Other people are feeling like they have a really bad cold or, as you said, mild illness, which I'll come back and explain. And that goes on for a few days, and then they start feeling really, really bad and, again, end up needing to be hospitalized. So serious illness is really when you're having a lot of trouble breathing, when your fever is spiking. So you had a low-grade fever, and all of a sudden it starts shooting up. When you can't hold anything down, so you're either vomiting a lot or you're unable to, your throat's hurting so much, you're not swallowing, you're not taking anything in. Those are really signs that you need immediate medical attention, and you need to call your healthcare provider. And if it's really serious and you're having trouble breathing, you need to call 911 and have a transport to an emergency room. Mild illness tends to range from, I've kind of got a cold, I'm stuffed up, I'm coughing a little bit, I'm uncomfortable, I have a bad headache, I have a low-grade fever, it's about 100. To people who actually, would consider mild illness, I'm exhausted, I need to stay in bed, I have a lot of aches and pains. For some people, they're experiencing abdominal symptoms as well. So, we don't want to rule that out. It's really kind of mimics sort of a mild flu. But you know your body best. And most of us have all experienced what we would consider to be mild illness. And most of us have also had bouts where we felt really, really sick and we knew it was time to get a doctor. So trust yourselves. If you, in fact, don't usually run any fever at all and now you're running 102, that for you is a significant fever and would require that you call your medical care provider and check in. If you have any underlying health conditions, you're pregnant.
I'm sorry, what about the smell and, I'm sorry, before I forget,
Okay.
the smell and taste issue? A lot of people are making a big deal about that.
Yeah, I don't know what the science is on that. So again, I would say if you're really concerned, always talk to your provider. The smell and taste is not the defining characteristic at this point of COVID-19. But again, if you're concerned, my advice is always, talk to your healthcare provider. And if you don't have a healthcare provider, call 211 so they can connect you to one. But thanks for your question.
Barbara.
We have time for one more question.
Okay, our final question then today will come from the line of Haley Menguia, representing the LA Daily News. Your line is open.
Hi, yeah, I actually have two questions. So first of all, I wanted to know if you could provide an update on the arrival of the Navy ship Mercy and what the logistics of that will look like when it arrives for transferring stations. And second, can you provide any more details on the 4 new deaths in terms of city, age, underlying health conditions?
So on the USS Mercy, it is on its way here, and we're thinking either the end of this week or the beginning of next week. We're getting a confirmation, but it is on its way as we speak. And then I'll let Dr. Ferrer talk about the second, and we will notify everyone when we know it's going to be arriving. Dr. Ferrer?
Okay, sorry, and just quickly, though, before the second question, will LA County be in charge of transferring patients or coordinating that, or what agency will be in charge?
Well, Dr. Galley is going to be coordinating. I mean, as I said earlier, she's each and every day following the census in our hospitals, especially the ICU. And the USS Mercy is not going to be used for COVID. It's going to be used for patients that need to be moved out of the hospital in order to make room. So we're going to be, Dr. Galley will be coordinating probably through our EOC to make sure that runs smoothly. But the ship is being operated by the Navy. There will be no county employees on that. It's all equipped and has all the staff on the ship as it arrives. And here's Dr. Ferrer.
Okay.
Yeah, we'll be including more information on the deaths in our press release. We're just still finalizing it, but we do know, unfortunately, the young person who died was a person from Lancaster, and we're still confirming the data on the 2 other deaths that happened outside of, not in Long Beach. One person obviously was a Long Beach resident that we reported today. That was the case that Long Beach reported yesterday. And we'll be trying to complete investigations on the other 2 cases. But that's the information we have now. I do know that one of the 3 people that died, we have confirmed, was elderly and had underlying health conditions. But we'll get that out in the press release, which should go out shortly. And,
okay, thank you.
Thank you. And I know we're going to now turn to Spanish, to remarks in Spanish. And I believe that we've got Jorge here from DMH. We're really virtual now.
Please excuse me, this is the operator. Would you like me to delete the people that are in queue? Okay, thank you.
Saludos a todos, a nuestros familiares, amigos de habla hispana. Estamos pasando por momentos impredecibles. En estos tiempos es importante que nosotros nos mantengamos informados y no dejemos que el miedo nos domine. En tiempos tan extraños como estos, es importante armarse con información, ya si ustedes o algún familiar ha pasado por problemas de salud mental. En estos momentos, muchas personas obviamente tenemos síntomas de depresión, de ansiedad y de otros problemas mentales. Entonces es muy importante que pongamos atención a lo que pasa, especialmente también con los niños que quizás en estos tiempos que están aislados y están en casa no entiendan lo que está pasando. Importante que nosotros como padres de familia les hablemos al nivel que ellos puedan entender lo que está sucediendo. En particular, estamos tratando de asegurarnos, la seguridad es lo más importante. Es importante mantener cierta distancia a 6 pies para que no contagiamos a otras personas. No se trata simplemente de lo que pasa con nosotros, sino también lo que podemos infectar a los demás, a nuestros seres queridos. Es un virus muy infectuoso, muy contagioso, y tenemos que mantener mínimo unos 6 pies de distancia. En estos tiempos donde obviamente no podemos llevar las rutinas normales, estos próximos meses nos van a retar a todos de tratar de mantener la calma y mantener la salud. Para ustedes que necesitan ayuda inmediata, es muy importante que encuentren a alguien con quien hablar. Es importante también reconocer de que si no encuentran a una persona profesional, pueden hablar con cualquier persona que esté, especialmente aquellas personas que están aisladas, los mayores de edad, las personas que están enfermas. Importante tratar de llamar para que ellos tengan contacto y tengan ese sentido de socialismo que es tan importante en estos tiempos. Si es una emergencia, si necesitas ayuda de salud mental, por favor, no dejes de llamar. El Departamento de Salud Mental está disponible a recibir tus llamadas. Como siempre, tenemos una línea de acceso que está abierta las 24 horas al día, 7 días de la semana. Y el teléfono para marcar es 1-800-854-7771. Nuevamente, ese teléfono es 1-800-854-7771. Se te atenderá en español con personas expertas que conocen no solamente las necesidades lingüísticas, pero también culturales. Así es de que no dejes de llamar si es que estás teniendo una crisis emocional o mental, o si necesitas algún tipo de recurso, no sabes dónde conseguir la ayuda. Aquí estamos para proveerte ese tipo de asistencia. Y también es importante ver las cosas que sí se pueden hacer en vez de dejarnos dominar por el miedo. Es muy importante en estos tiempos mantener rutinas saludables, por ejemplo, lo que es dormir bien, descansar, comer alimentos vegetales, verduras, frutas, hacer ejercicio, mantener tu mentalidad y pues obviamente no solamente calmar tu ansiedad, pero también proteger tu cuerpo, que no se desgaste con la ansiedad. Así es de que buenos alimentos, buena higiene de dormir, buena higiene de comer. También es importante en estos tiempos, si estás encerrado, mantener las actividades nuevas. Por ejemplo, encontrar un hobby, ayudar a tus hijos a hacer la tarea con cierta distancia. Ayudar a entender que pues también podemos aprovechar de este tiempo para llegarnos a conocer mejor, hablar con nuestros hijos y ayudarles a mantener también obviamente la ansiedad y la tensión que han de estar sintiendo ellos. Es importante también evitar hábitos peligrosos, como por ejemplo es el alcohol y las drogas. En estos tiempos de ansiedad es muy importante que nosotros no nos mediquemos con drogas y sustancias que van a reducir nuestra habilidad de pelear contra cualquier virus, especialmente para aquellas personas que fuman, ya que pues sabemos que los pulmones son los más afectados en estos tiempos. Así es de que si fumas, deja de fumar y no uses esos recursos tan importantes que tienes de tus pulmones. En estos tiempos de tanto reto, lo bueno es de que hemos visto la conexión social. Los departamentos de salud mental, los departamentos del condado están colaborando más que nunca. Agradecemos a nuestra mesa de directores y supervisores del condado de Los Ángeles. Nuestro departamento está aquí para ayudarles y si también en vez de dejar que nos vencen el miedo. También hay ciertas actividades que podemos hacer para recordar las necesidades de los otros. Llevarle comida a aquellas personas que no tienen alimento y que están solas. Mantente en casa y trata de evitar salir a las calles. Si sales, báñate, lávate las manos con frecuencia. Pon atención a tu higiene personal. Aíslate en cuarentena y mantén buena distancia de los demás. Muchísimas gracias, cuídense mucho, estamos aquí para ayudarles. Gracias.
Muchas gracias, Jorge. Buenas tardes a todos. Me llamo Bárbara Ferrer, soy la directora del Departamento de Salud Público del Condado de Los Ángeles. Cada día me siento muy bendecido de estar aquí con la supervisora Barger y el liderazgo de nuestro condado. Quiero agradecerles a todos los que están aquí y a los que están en otros lugares por el trabajo y el compromiso que están haciendo con este esfuerzo. Para actualizarlo sobre nuestro estado actual, te voy a dar un poco de información. Estoy bien triste hoy a informar que hay 4 más muertes adicionales. Esto incluye una que informó el Departamento de Salud en Long Beach ayer. Esto eleva el número total de muertes a 11 del condado de Los Ángeles. Trágicamente, una de estas muertes fue una persona menor de 18 años, una realidad de que el COVID-19 infecta a las personas de todas las edades. Estos números son devastadores para reportar porque detrás de estos números hay familias y amigos que están experimentando una pérdida terrible. Nosotros, la comunidad del Condado de Los Ángeles, nos mantenemos en nuestros pensamientos y oraciones. Hoy estamos reportando 128 casos nuevos y el número total de casos en el Condado de Los Ángeles del COVID-19 es ahora 662. 119 casos han sido en algún momento hospitalizados y esos son como 10% de todos los casos positivos. Los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Hasta el 23 de marzo, más de 5.700 personas se habían sometido a pruebas en el Condado de Los Ángeles y el 10% fueron positivas. Las cosas están mejorando sobre encontrar un sitio donde puedes sacar una prueba, pero la capacidad está todavía limitada y el tiempo de esperar para obtener resultados significa que todos nosotros debemos desafortunadamente tener prioridad que no puedes sacar una prueba si no tienes síntomas del COVID-19. En este momento, esto significa que las pruebas están disponibles principalmente para personas sintomáticas y para quienes un proveedor clínico ha determinado que las pruebas son apropiadas. Las limitaciones en torno de las pruebas hacen que sea aún más importante para que todos nosotros continuamos siguiendo todos los requisitos y medios de distanciamiento social. Muchas gracias. Estamos aquí para coger unas preguntas. Oh, sure. We're open for questions.
All right. Ladies and gentlemen, please press 1 followed by the 0 for questions. 1 followed by the 0. Okay. Our first question comes from the line of Luis Treto with the Telemundo. Please go ahead.
Doctora Ferrer, la pregunta que tenemos, estamos recibiendo muchas llamadas del público, las personas están confundidas porque algunas dicen que tienen fiebre, van al hospital y han tenido contacto con personas que tienen el COVID-19 y no se les ha atendido. ¿Qué le puede decir a esas personas? ¿Qué instrucciones deben de seguir?
Todas las personas, por favor, no van al hospital sin hacer una llamada antes o si no es una emergencia. Es bien importante que los hospitales son para personas que tienen una emergencia o que tienen un médico que le han mandado al hospital. El hospital no es el sitio para ir si quieres una prueba. Tienes que llamar a un médico para que ellos te avisan si es necesario que coges una prueba. Si hay mucha gente que tienen catarros, que tienen el flu, y no se necesitan sacar una prueba. Las pruebas son ahora en este tiempo, que no tenemos muchas pruebas. Todavía están para personas que el médico decide que sí tienen unos síntomas que quizás son del COVID-19 o que tienen contacto con una persona con el COVID-19 y tienen síntomas. Todas las personas tienen que tener síntomas o ahora no tenemos capacidad para que lo podemos a darle a todos que quieren la prueba. Yo sé que esto es bien difícil para la gente que vive en el condado. Hay mucha gente que sí serán mejor si le pudieran dar la prueba, pero como que no tenemos la capacidad, ahora tenemos que guardar esa capacidad para la gente que sí están bien enfermas. Muchas gracias por la pregunta.
Y la siguiente pregunta sería, ¿qué le puede decir a las personas? ¿Cuáles son los criterios para que se puedan hacer la prueba? ¿Cuántos años deben de tener?
No, no es nada por los años que uno tiene, es porque qué decide el médico. El médico que tú tienes, ese es la persona que hace las decisiones y no tiene nada que hacer con la edad de una persona. Sí, las personas que son más ancianos le van a sacar las pruebas más rápido si ellos están bien enfermas, porque ellos sí se pueden dar una enfermedad bien serio. Pero gente que son jóvenes sí todavía le dan las pruebas si es necesario.
And next we will go to the line of Julia Jones with CNN. Please go ahead.
Hola, esta pregunta es para la doctora Ferrer también. Si podría, por favor, primeramente nos dar más detalles sobre esta víctima menor de edad de Lancaster, si tenía otras condiciones de salud o qué pasó. Y sí, fue, creemos, la primera víctima menor de edad del país, ¿no? Y segundamente, un poco más sobre el número de profesionales de salud y han tenido un test positivo para el COVID.
Para la primera pregunta, no tenemos más detalles sobre el joven que se murió. Sabemos que es de Lancaster. Todavía estamos haciendo las investigaciones a ver si él tenía otras complicaciones, pero de veramente no tengo esa información ahora. Es un día bien triste. De veramente para el condado es la primera persona que ha morido que tiene menos de 18 años, pero no sé por seguro si es el primero por el estado. Tengo que buscar la información. Y de veramente no entendía la segunda pregunta. ¿Eso me lo puedes dar de nuevo?
Sí, claro. Sí, de los profesionales de salud, o sea, healthcare professionals,
sí,
que han testado, hay números, hay cifras de esos que fueron testados para el COVID.
Hay mucha gente que sí hicieron las pruebas. No tengo esos detalles conmigo ahora, pero si llamas a mi oficina te doy lo que tengo. Sí hay, pero no lo tengo aquí, ¿ok?
Gracias. Y solo un follow-up que dice, entonces que no estás seguro si es la primera persona menor de edad en el estado o en el país.
Definitivamente en el país no es el primer, pero no sé si es el primero en el estado. Soy seguro que es el primero en el condado.
Gracias.
Okay. Tenemos tiempo para una más pregunta.
For additional questions, please press 1 followed by the 0. other participants are queuing up at this time.
Okay, but muchas gracias a todos. This concludes our press briefing for today, and thank you, everybody.
Ladies and gentlemen, that does conclude our conference for today. We thank you for your participation in using the AT&T Executive Teleconference. You may now disconnect.